Lewis, just one moment, and as well for the video feed for the boardroom to join. Everyone that has joined the meeting, if you could please stand by for just a moment. Good morning, everyone. I think we have the video feed working now. Chairman Boyd, can you hear me? If you're speaking, Chairman, I'm unable to hear you. Can you hear me, Chairman?
You're fine.
Okay, thank you. I can hear you now.
Are you okay now, Denisha? You can hear me?
Yes, I can hear you now.
Okay. And you tell me when we're ready to start, and that everybody from the board is on, as we've had some issues in the past. Make sure people can be muted and unmuted, and everybody that's going to be on is on. Would you do that, please?
Yes, Chairman, I did check. For the board members that are going to be present, they are on the line.
Okay, very good. So are you ready to call the roll, please?
Please allow me one moment to check. We were lacking one presenter, and let me check and see if they have joined.
Okay, well,
Lewis, have you
you
joined the
call the
meeting?
roll when you're ready then.
Okay, thank you. Lewis, have you joined the meeting? Okay, Chairman, we'll go ahead and move forward, and I'll reach out to Mr. Lewis. He may be having some technical issues, but he's further down in the agenda. So I'll go ahead and begin with the roll call. Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
Mark Trail,
Present.
Anthony Williamson,
Here.
David Cruz,
Here.
Kenneth Davis, and Mr. Davis did provide notification that he would not be able to join. Russ Childers, and Mr. Childers provided notification as well. Chairman Boyd, that concludes my roll call.
Thank you, Denisha. And with that roll call, I believe that we have a quorum. And so with that, I will call the meeting to order. We have a very full agenda today. We have, as a board, we're going to be asked to vote on three items that will be up for final adoption, four for initial adoption, and also to vote on the state health benefit plan for the 22 calendar year. So that is the agenda that we have this morning. And the first thing on the agenda is approval for the minutes of the previous board meetings, the June 10 and the June 29 special meeting that was called. And I believe that we could approve both in one vote if that's appropriate. And I'll call on Russell Crutchfield, our secretary. Have you had a chance to read the minutes, and would you recommend approval?
Well, good morning, Chairman Boyd. I have reviewed the board meeting minutes from June 10th and June 29th, and I have found them to be correct and in order. Staff did a great job putting these together, and I move that we approve the June 10th and June 29th board meeting minutes.
The motion has been made for approval of the minutes. Is there a second?
Trail, second.
Mark Trail has seconded that. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, the minutes are approved. Thank you very much, Russell. The next item on our agenda I will move to is a report from the Care Management Committee meeting, which I believe was held via WebEx this morning. And I'll call on Anthony Williamson, chairman of that committee, for his report, please.
Thank you, Chairman Boyd. The Care Management Committee did meet this morning. We first reviewed again the purpose of the committee, which is to share, to receive and hear updates on care initiatives and help improve performance and outcomes, and provide a community voice. The committee will be meeting quarterly on a go-forward basis, unless we need to change that. We had two main topics this morning. Lynette Rhodes gave us an update on the Peach State WellCare integration or merger that took place in the recent past. In January of 2020, Centene purchased WellCare. Centene is the parent of Peach State, and the department was heavily involved in that merger to ensure that things went smoothly. They focused on things including continuity of care, the provider network, call center operations, integration of systems in terms of the ability to get claims paid, staffing levels, as well as facility operations and COVID readiness. In January of 2021, they conducted a readiness review and confirmed that the transition was good to go, which took place in May of 2021. There was an opportunity for members to opt to a different plan. About 50,000 folks decided to move to a different plan, and roughly 450,000 moved to Peach State. And the integration overall has gone very well, very few complaints, and there's ongoing monitoring. As of August 1st, the total managed care enrollment is just over 1.8 million members, with Peach State having roughly 944,000, CareSource 373,000, and AmeriGroup 497,000. The next item that we heard from Deputy Executive Commissioner Dr. Holloway. He gave us a very good report on the quality strategy. This is something that is required by CMS for states that contract with MCOs to assess and improve the quality of care. There's three aims of the quality strategy, and that's to improve the health and services and experience for the enrollees, smarter spending, and then also this quality strategy is being utilized in our fee-for-service plan. So items that they're focusing on include addressing healthcare disparities, looking at things such as race, age, gender, and the like, social determinants of health. And they're going to be trying to focus on improving access to care, increasing wellness and preventative care, improving outcomes on chronic diseases, focusing on maternal and newborn care, as well as improving behavioral health outcomes and overall satisfaction with the plan. As far as smarter spending, there will be a focus on trying to decrease unnecessary hospitalizations as well as emergency department utilization, and an increase in the use of telemedicine as that becomes more available in the region. The last item that they're going to focus on is review the increase in the number of waiver participants who receive timely follow-up care after a hospital visit. The plan was submitted to CMS on May 31st as required. Typically that's a 90-day process, and they will be confirming if the plan is on target with expectations, and we are currently awaiting that feedback. And those were the two reports that we had this morning. It was a good meeting of the Care Management Committee, and I'll stop there, Mr. Chairman.
Thank you, Mr. Williamson, for that comprehensive report. Are there any questions from the board or comments, please? Hearing none, thank you very much for that report. Next on our agenda is the Commissioner's report, and I will turn it over to Commissioner Noggle.
Thank you, Mr. Chairman, and good morning to the rest of the board members on call this morning. It's been a fun First, I guess 5 or 6 weeks. I particularly enjoyed the opportunity to speak with each of you over the past several weeks and appreciate you taking the time to do that with me and kind of share your experiences and insights into the department. I did want to take a moment and just publicly thank Commissioner Barry for his assistance over the past month or so during this transition, as well as just his continued leadership and his friendship to me over the past 18 months or so and continuing on. And I know he'll continue to serve as a resource to the agency. And I want to say thank you to all of the executive leadership team and the rest of our leadership team for welcoming both myself and Deputy Commissioner Ryan Loke as we are working to get settled. Everyone's been super helpful. It has been a busy first month or so. We spent a lot of time and a lot of meetings getting to know the divisions and the work that's happening within the department. We've also spent a lot of time in a number of meetings with all of our external stakeholders and partners, including folks like our House and Senate appropriation chairs, House and Senate budget offices, other key legislators and partners, and numerous business partners. So been very insightful and been very helpful for us to kind of lay the land of where we stand today. What I can tell you so far is that there are a lot of talented staff members here at DCH and a lot of really good work is happening. I think what you'll see from me in the coming weeks and months is an effort, and some of my goals will be to highlight some of that great work a little bit more for you. And I'll encourage different and other staff members to participate in these board members so you can hear not only from the executive directors and the division leads, but also some of their staff that are really doing the work day in and day out, and so that they also get this experience to interact with you and share information on what they're doing. I'm currently working on our strategic plan and our priorities and kind of evaluating where we stand on those fronts. But I will be working with our staff, likely to add at least one additional goal to our current plan before we submit in September. And that'll be to establish a little bit more structure around what those strategic priorities are and how we track and hold each other accountable for those. Again, in the coming months, I think you'll should expect to hear me talk more and more about our internal performance measures and our KPIs, our key performance indicators. And really a renewed focus on how we optimize our internal operations in an effort to provide healthcare outcomes and the best service possible to all of our constituents. And doing so, I think you'll come to learn that I'm pretty big on data and quality, as you just heard some updates about our quality plans. But I think you'll see us use those tools and those teams more and more to measure our performance. Again, not only internally, but also to measure how we're doing serving our constituents as well. So I'll look forward to sharing more of those plans with you as they continue to develop. As Chairman mentioned, we do have a full agenda today. I think several of these are really good items. One we're bringing back to you after some revisions, but have a lot of support behind from our external partners that had some input and some comments into those. So again, just thank you for your support thus far, and I look forward to working with you. I remain available to all of you anytime you should have questions, and thank you.
Thank you, Commissioner, for that report out. And are there any questions from board members or comments for the Commissioner, please? Hearing none, we will move into our agenda of items that we'll be asked to consider. And the first is the medical assistance plans and the independent care waiver program. Lynette Rhodes will make the presentation, and this will be considered for final adoption. Please proceed.
Hi, good morning, Chairman Boyd, Commissioner, and the members of the board. Just want to confirm that you all can hear me.
We can hear, yes.
Great. On June the 10th, we presented for initial adoption our request to renew the independent care waiver program, as well as a request to increase the rates by 10%. An opportunity for public comment was held on June the 15th at 10:30 a.m. via WebEx. Written comments were due on or before July the 12th. We did not receive any oral comments or any written comments. As previously indicated, we are requesting a 5-year renewal of the waiver program, and there are no proposed changes to the service type, description, or maximum allowable units. Accordingly, we are requesting final adoption from the board. I will pause for any questions.
Are there questions or comments for Lynette from the board, please? Hearing none, is there a motion? Do I hear a motion for approval for final adoption?
Trail, so move.
Mark Trail has moved for final adoption approval. Is there a second to that?
Folsom, second.
Roger Folsom has seconded that motion. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved. Thank you very much, Lynette, for that presentation and your work on that for final adoption. Next on our agenda is rules and regulations that relates to personal care homes. And Melanie Simon will make that presentation. So Melanie, you may proceed.
Good morning, Mr. Chairman. Can you hear me?
Yes, we can.
Great. Mr. Chairman, Commissioner Noggle, and members of the board, the Division of Healthcare Facility Regulation presents rules today for final adoption for personal care homes. These rules are found in Chapter 111-862 of the Department's Rules and Regulations and are necessary to comply with portions of House Bill 987, otherwise known as the Disabled Adults and Elder Persons Protection Act of 2020. An opportunity for public comment was held on July 14th of 2021. Written comments were due on or before July 16th of 2021. We did not receive any oral comments. Written comments were received from Terry Barcroft of Wesley Woods Senior Living, Jessica Tobine Grozen of Arnold Golden and Gregory, Jenny Helms, President and CEO of Leading Age Georgia, John LaHood on behalf of the Georgia Senior Living Association, and Ruth Lee, Chair of the Georgia Council on Aging. I will review the comments that were received, and I will pause at the end to see if you have any questions. The first comment, a commenter requested clarification regarding whether registered nurses and licensed practical nurses may be counted in the average monthly minimums for direct care staff. Another commenter requested that the average monthly minimum for direct care staff include any staff appropriately trained that work at the facility, even if assigned to a different unit. The DCH response is that the facility may use a variety of staff to meet the direct care average monthly minimum requirements, including RNs and LPNs or staff typically assigned elsewhere, provided the training requirements have been satisfied and the staff are actually providing direct care. However, a facility may not count staffing hours in other units while simultaneously claiming them as part of the monthly minimum, nor may the facility count the same RN hours toward both the RN coverage requirements and the direct care average monthly minimum. The second comment, a commenter requested that the department provide flexibility regarding the requirement that the facility provide one direct care staff person on each floor during times when most residents are in a particular location, such as during mealtime in the dining hall. The DCH response is that this rule change is proposed as a response to issues noted during the survey process when residents have been left isolated without supervision in larger multi-floor facilities. The department maintains its position that such residents are at risk without adequate staffing on each occupied floor. Number 3, a commenter requested clarification on whether the memory care center must have an RN or LPN present on site to meet the minimum staffing requirements, or whether availability, such as working in a nearby building, or virtual availability would suffice. Similarly, a commenter asked that the department utilize an average monthly minimum standard for the RN and LPN staffing requirements due to the current shortage of such clinicians in the state. The DCH response is that the language in House Bill 987 requires that the RN and LPN staffing be present on site at the facility. Accordingly, virtual staffing coverage is not permitted in the proposed rules. It is permissible for staff to move between buildings as long as they are not counted on multiple rosters for purposes of staffing minimums. Additionally, the department will not utilize an average monthly minimum standard for the RN and LPN staffing requirements because the statute only references an average for the direct care monthly minimum standard. Number 4, a commenter requested clarification on the RN and LPN nursing hours required for memory care centers. The DCH response is that under the state statute as reflected in the proposed rules, a memory care center must have an RN, LPN, or certified medication aide present at the facility at all times. If this individual is an RN or LPN, their hours will count toward the minimum hours of nursing coverage required based on the number of residents. Number 5, a commenter requested that the department define the terms on-site and available in the building with respect to staffing requirements for personal care homes and memory care centers. The DCH response is that the department will interpret these items and terms as they are commonly used and defined. The department will also consider adopting interpretive guidance for the proposed rules if necessary in the future based on survey experience. Number 6, a commenter recommended that the department allow facilities to utilize their own forms for tracking staffing ratios rather than mandating a particular form. Another commenter requested that the department share the proposed form prior to implementation of the rules. The DCH response is that the department will work with the provider community in the development of any required forms needed for staffing documentation. It is critical that the department have the ability to survey efficiently and not spend unnecessary hours during the survey process reviewing unique tracking methods and forms. Number 7, a commenter asked the department to include stakeholders in the development of any checklist that may be required to train staff and to provide such checklists prior to implementation of the rules. The DCH response is that the department will solicit input from the provider community in the development of any required checklists needed for staff training. Number 8, a commenter requested that training be portable from one facility to another via some type of certificate. The DCH response is that the department will consider this request, but anticipates that some of the training may be needed at the facility to orient new staff to the policies and procedures unique to that location. Number 9, a commenter stated that the department should allow the administration of liquid morphine to personal care home residents not in a memory care center if done by a licensed nurse. The DCH response is that the department lacks the statutory authority to make this proposed change. Number 10, a commenter stated that limited nursing services should be permitted in personal care homes. The DCH response is that the department lacks the statutory authority to make this proposed change. Number 11, a commenter requested that the department issue interpretive guidance for the proposed rules. The DCH response is that the department will consider adopting interpretive guidance for the proposed rules if necessary in the future based on survey experience. And number 12, a commenter stated that the proposed rules will positively impact the safety, health, and well-being of aging Georgians across the state and asked that the board approve the proposed rule changes in their totality. The DCH response is that the department appreciates the positive comment. I realize this is a lot of very detailed information. We are requesting consideration for final adoption today, but I'm certainly happy to answer any questions you have about the proposed rule changes or the comments received.
Thank you, Melanie. Are there questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Trail will so move.
Mark Trail has moved for approval for final adoption. Is there a second?
Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved, Melanie, and thank you very much for that very comprehensive report. It is approved. Next, Melanie, you may move to your next item that is on the agenda, which is rules and regulations for assisted living communities.
Thank
Please
you.
proceed.
Thank you, Mr. Chairman. The Division of Healthcare Facility Regulation also presents rules today for assisted living communities. These rules are found in Chapter 111-863 of the Department's Rules and Regulations and are necessary to comply with House Bill 987. So the same legislation is involved with these rules as with the personal care home rule changes. An opportunity for public comment was held on July 14th, 2021, and written comments were due on or before July 16th of 2021. 3 oral comments were received from Tom Bauer with Leading Age Georgia, John LaHood on behalf of the Georgia Senior Living Association, and Mary Lee Boatwright Quinn, Director of Government Affairs for the Georgia chapter of the Alzheimer's Association. There were also written comments received from Terry Barcroft with Wesleywood Senior Living, Jessica Tobin Grosine of Arnold Golden and Gregory, Susan Harrison, Jenny Helms, President and CEO of Leading Age Georgia, John LaHood on behalf of the Georgia Senior Living Association, Ruth Lee, Chair of the Georgia Council on Aging, Tony Marshall, President and CEO of the Georgia Healthcare Association, Kim McRae, co-founder of the Culture Change Network of Georgia, and Mary Lee Boatwright Quinn, Director of Government Affairs for the Georgia chapter of the Alzheimer's Association. We received very similar comments for these rules, so I will not go through the comments again that are the same as the ones from the personal care home rules. I will simply cover the one comment that was unique to these rule changes, and that is number 9. A commenter requested that the training requirements for memory care centers be strengthened further as follows: to add person-centered care and person-centered dementia care to the training requirements for all staff, not just the direct care staff, to use a broader definition of family, to incorporate a stronger focus on person-centered care in the resident needs assessment, and to incorporate training on appropriate use of antipsychotic and psychotropic medications. Commenters also suggested specific training tools and guides that facilities can use to improve care for dementia residents. The DCH response is that the department greatly appreciates this feedback and will work with a variety of stakeholders prior to finalizing any specific checklist or recommendations on training. That was the only comment received that we have not already covered in the prior rule presentation. And I'm certainly open to answering any questions from the board, and the division and department are requesting consideration for final adoption of these rules today.
Thank you, Melanie. Are there any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
I move for adoption. This is David Cruz.
David Cruz has moved for final adoption. Is there a second?
Folsom, second.
Roger Folsom has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Melanie, and thank you very much. Next item, that concludes our approvals request for final adoption. Our next items we will address are initial adoption proposals. And Lynette Rhodes will come back and present the first one with the medical assistance plan with the state amendment increase in supplementary quality incentive payments to eligible nursing facilities. So Lynette, you may proceed.
Thank you, Chairman. Pending Centers for Medicare and Medicaid Services approval, the department is proposing to increase supplemental quality incentive payments to eligible skilled nursing facilities effective August the 13th of this year. Incentive payments will be paid to skilled nursing facilities that demonstrate improvement in the quality of care rendered to Medicaid beneficiaries. The state fiscal year 2022 appropriations bill includes funding for the department to increase the quality incentive payment. For state fiscal year 2022, the state cost is $12 million. The federal cost is $24,253,776 for a total cost of $36,253,776. $776. The department collaborated with both internal and external stakeholders to develop the following quality incentive plan. Utilizing calendar year 2020 data as the baseline, nursing facilities that demonstrate improvement in the following 4 categories will be eligible for a supplemental payment. The 4 categories are as follows. The first is high-risk, long-stay residents with pressure ulcers. The second is long-stay residents who received an anti-anxiety or hypnotic medication. The third is long-stay residents who received an antipsychotic medication. And the fourth is long-stay residents with a urinary tract infection. Nursing facilities must demonstrate improvement in at least one or more of these 4 areas in order to receive the supplemental payment. The supplemental payment will be based on the percentage of improvement ranked by decile for each of the 4 categories. Supplemental payments will be distributed to eligible nursing facilities twice per year. However, in year 1, which is state fiscal year 22, eligible nursing facilities will only receive 1 payment. For each subsequent year after calendar year 2020, the base year will be adjusted annually to reflect improvement against the prior year. For example, calendar year 2021 would be paid out against improvement identified in calendar year 2020. For calendar year 2022, the payments would be based and paid out against improvements for calendar year 21, and so on. An opportunity for public comment will be held on August the 19th at 10:30 a.m. via WebEx. Written comments are due on or before August the 26th, 2021. I will now pause for any questions from the board.
Any questions or comments from the board, please, for Lynette? Hearing none, is there a motion for approval for initial adoption?
Trail, so move.
Mark Trail has moved for approval initial adoption. Is there a second?
Second, Cruz.
David Cruz has seconded that motion. All in favor say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved for initial adoption. Lynette, thank you very much. You may proceed to your next area.
Thank you. Pending approval from the Centers for Medicare and Medicaid Services and effective for services provided on or after August 13th of 2021, and subject to payment at fee-for-service rates, the department proposes to modify the rate methodology for portable radiography and accredited mobile imaging services for Medicare crossover payments. The rate will change from a flat rate of $109.77 per trip to 100% of the current Medicare reimbursement rate. This change is estimated to increase expenditures as follows. For state fiscal year 2022, the funds for state funds represent $250,000. Federal funds represent $541,139 for a total fund of $791,139. The department will modify the rate methodology specific to 113 codes to mirror the Medicare reimbursement rate. An opportunity for public comment will be held on August the 18th at 11:30 a.m. via WebEx. Written comments are due on or before August the 25th, 2021. I will pause for any questions from the board.
Mr. Chairman, I have a question. This is Mark Trail.
Yes, please.
Have the funds for this been appropriated, or do we anticipate it being a future request?
They have. We received $250,000 in this year's appropriations bill.
Thank you, Mr. Chairman. I yield.
Any other questions, comments? Hearing none, is there a motion for approval for initial adoption?
Crutchfield move to pass.
Mr. Crutchfield has moved for initial adoption approval. Is there a second?
Trail, second.
Mark Trail has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved for initial adoption. Thank you very much, Lynette.
Thank you.
Next, we'll move to medical assistance plan, the state plan amendment for ground ambulance upper payment limit for initial adoption. And Kim Morris, Director of Reimbursement, will make that presentation. Kim, you may proceed.
Good morning, Chairman, Board, and Commissioner, and members of the DCH Board. Pending approval by Centers for Medicare and Medicaid Services, I am presenting for initial adoption a proposal to modify the average commercial rate calculation and frequency of data collection used to calculate the ambulance supplemental payment with an effective date of August 13, 2021. On July 1, 2020, the department implemented a supplemental payment program for hospital-based or government-affiliated fee-for-service ground ambulance providers. The calculation of the average commercial rate required ambulance providers to submit 3 to 5 commercial payer rates to the department. During the first year implementation of the program, the department identified that several rural ambulance providers could not provide 3 commercial payer rates for each of the required healthcare common procedure coding systems. The department could not compute an average commercial rate for the specified HCPC codes, nor calculate a supplemental payment for those HCPC codes. The state will modify the state plan amendment to apply a medium state rate for specific health HCPC codes when a provider cannot submit 3 commercial payer rates in lieu of computing an average commercial rate. Secondly, to improve efficiencies for both the ambulance providers and the state, the department will modify the state plan amendment language to allow ambulance providers to submit commercial rates every 2 years instead of twice a year. Total cost for these changes is $20,333. An opportunity for public comment will be held on August 17, 2021 at 11 a.m. via WebEx, and written comments are due to the department by August 24, 2021. At this time, I will pause to see if there are any questions.
Mr. Chairman, I have a question, actually 2.
Yes.
If I might, this is Trail, but first of all, is it reasonable to understand that the reason they couldn't have 3 commercial rates is because it's some of the more rural parts of our state?
Yes, that is correct.
Okay. The other question is, will this supplemental payment be supported on the state side by intergovernmental transfers?
Yes, they are supported by intergovernmental transfers.
All right. Thank you, Mr. Chairman. I yield.
Any other questions, comments? Hearing none, is there a motion for approval for initial adoption?
This is Folsom, motion for approval for initial adoption.
Mr. Folsom has made the motion for approval initial adoption. Is there a second?
Second, Cruz.
David Cruz has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much. And you may proceed to your next item, please.
Again, pending approval by Centers for Medicare and Medicaid Services, I am presenting for initial adoption a request to remove the provision that prohibits a physician from receiving supplemental payments through the Physician Upper Payment Limit Program and the Enhanced Primary Care Reimbursement Rates simultaneously. Per provisions of the Affordable Care Act, physicians with a primary specialty designation of family medicine, pediatric medicine, general internal medicine, or an associated subspecialty could elect to receive enhanced reimbursement rates for certain CPT codes. The enhanced reimbursement was provided under the Affordable Care Act, which ended in December 2014. Beginning July 1, 2015, the department, through a state plan amendment, carried the enhanced primary care increases forward and continued to reimburse eligible physicians at the higher rate. Per the provisions of the state plan amendment, primary care physicians who received supplemental payments through the Physician Upper Payment Limit Program were prohibited from receiving the enhanced primary care provider rate increase. Removal of this provision will allow eligible physicians to participate in and receive both the upper payment limit, supplemental payment, and the enhanced primary care rate increase beginning October 1, 2021. Included in the body of this document is a list of the eligible teaching hospitals. Total cost for this change is $64,968,305. State funds will be paid through IGT. There will be an opportunity for public comments on August the 18th, 2021 at 10 a.m. via WebEx. Written comments are due to the department by August 25th, 2021. At this time, I will pause to see if there are any comments.
Any questions or comments from the board, please? Hearing none, is there a motion for approval for additional adoption?
Trail, so move.
Mr. Trail has moved for initial adoption. Is there a second, please?
Folsom, second.
Roger Folsom has seconded. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved. Kim, and thank you very much for your
Thank you.
presentations this morning. That concludes the items to be considered for initial adoption. We'll now move into the related to the state health benefit plan. And first of all, Brandy Sylvan will, from Director of Government Relations, will present the Advisory Council statement.
Thank you, Mr. Chairman. Can everyone hear me okay?
Yes.
Okay, terrific. Thank you, Mr. Chairman and members of the board. I am here with you today to share a summary of the 2021 SHBP Advisory Council meeting, which was held yesterday. The SHBP Advisory Council was established in 2016 following the adoption of House Resolution 1382. The council is composed of both active and retired SHBP members from both the Teachers Retirement System and the State Employees Retirement System. The council was created to allow members an opportunity to share feedback with plan administrators. During yesterday's meeting, Executive Director Lewis Amos shared a presentation with the council to review the 2022 SHBP plan recommendations that will be presented to the board today. He shared an overview of the current member makeup as well as the recommended plan options for 2022. He also shared with the council some additional wellness programs that will be available to members in the new plan year. There were only 2 questions from council members, one related to the available plan options next year and the other related to the employer-employee cost share. The department appreciates the opportunity to interact with council members and have a platform to receive feedback from a variety of SHBP members. If there are any questions, I'm happy to answer them at this time.
Any questions, comments for Brandy, please? Hearing none, thank you very much for updating us on that. And then we will move to the next item, which we will be asked to vote on as it relates to rates and structure. is Lois Amos, Executive Director, State Health Benefit Plan, will make a presentation about the 2022 plan year design and rates. Please proceed.
Good morning, Chairman Board. Can everybody hear me?
Yes.
Okay. Lois Amos, Executive Director for the State Health Benefit Plan. Next slide. As you know, today I'm going to provide an overview for the goals for the 2022 benefit plan year, talk a little bit about the COVID-19 pandemic and its impact on the state health benefit plan. And then I'll go into the recommendations for the 2022 benefit plan year, talking about plan designs, plan options, wellness initiatives, minimum rates, and then open enrollment. Next slide. Our goals for the 2022 year. In 2021, currently, we explored opportunities for additional member benefit and focus on maintaining financial stability. For the 2022 year, we are seeking to continue our focus on improving member health, but we also want to focus on increasing the member involvement in the healthcare decision-making process and the total wellness initiative. Next slide. I want to talk a little bit about the Kovic Impact. As we all know, Kovic has had a significant impact throughout the country. And over the next couple of slides, I'll just kind of share with the board some information. So next slide. On this slide, what you're basically seeing is kind of from a claims perspective for the self-funded insurance plans. The top line is the goal line, which will reflect on medical. As you can see in Q2, there was in fact a dip in terms of overall utilization and cost, but as you can see, as we go forward through the remainder of 2021, we've seen a significant increase, and things have kind of rebounded. If you look at the bottom line, which is the blue line, that represents pharmacy costs, and as you can see, the pharmacy costs have remained fairly stable over between the 2020 year and even up to 2021. Next slide. As you look at COVID, obviously there are some things that we have to look at as it relates to what was going on with COVID, and in the 2021 and 2022, some of the things that we really want to look at in terms of the impact and what it's going to, how it's going to impact the state health. They're basically two separate areas. One is a inflator, and the other one is what's called suppressors. On the inflator side, we are looking at rebounds in claims for 2021 that was suppressed. We see that happen in terms of things that are now starting, utilization is starting to increase. The other concern is conditions. The members who neglected care during the pandemic, and especially those who had unmanaged chronic diseases, the concern is that it could result in more severe conditions. There's also some concerns of people who may have missed out on certain cancer diagnoses and screenings where it probably could have been treated early on in stage 1 or stage 2 that may now have gone up to stage 3, stage 4. Direct costs. I mean, there's some concerns as we all can imagine. Nobody really knows what the Delta variant impact is going to be on the plan as we move forward in the remainder of 21 and into 22. And then health systems, economic conditions. As we come to find out, there's a continued provider consolidation, and which means they'll have an increased market leverage and drive costs up higher. On the suppressor side, as we saw the claims that were suppressed in 2020, we're not certain in terms of whether or not we'll see an increase in terms of claims. We know that from an outpatient perspective, there may be some increases, but we're hoping from the inpatient perspective that those increases won't be as much. We have continued precaution in terms of the masking, social distancing. We're hoping that that's going to help in terms of diseases like flu and anything else that we can help to manage. Virtual care, we've taken full advantage of technology. We've seen a significant increase in the total of telemedicine and the use of technology in terms of providing care. And then the health system capacity, as we know, the health system has had some strains as it relates to their ability to provide care for our employees and their dependents. Next slide. The recommendations for the 2022 plan year, as you can see, this is the current 2021 benefit plans, and the recommendations is that we will not make any plan changes, plan design changes, and I'll go through that a little bit further. Next slide. The medical vendors will remain the same. United Healthcare, HMO, the high deductible health plan, the Medicare Advantage plan, Anthem Blue Cross Blue Shield, the HMO, the HRA plans, the Medicare Advantage plans, Kaiser Permanente, the regional HMO. The plan designs, as I indicated, will remain the same. No changes to copays, co-insurance, deductibles. On the area of benefit enhancement, we will be offering bariatric surgery in 2022. And we will be expanding our diabetes prevention program. This program is pretty much designed to address those who are pre-diabetic. As one of the things I indicated, we wanted to make sure the members take a more active role in their decision-making process. As we know, diabetes is probably one of the most highly costly chronic diseases that we have in the plan. So we really want to take an approach to try to really go toward prevention for those who are pre-diabetic. Next slide. On the pharmacy and wellness, CVS will remain the same. The PBM for our commercial and non-Medicare plans, there are no changes. Share Care will remain the wellness administrator for the 2022 year. They will be offering some additional services for enhanced behavioral health and mental health programming. Next slide. As it relates to Share Care, they currently have a program in place called Serenity Now. It's a suite of programs that's at no additional cost to SHBP or the members. And it includes, currently we're offering Unwinding Anxiety. That's a program designed to manage stress and anxiety. Carving to Quit, that program is designed to address quitting tobacco and vaping usage. So for the 2022 year, we'll be adding breath. That's a relaxation and meditation pod. And then Eat Right Now. It's designed to manage and control food cravings. Next slide. The commercial, as it relates to the rates, the recommendation to the board is for the rates to remain flat for 2022. The Medicare Advantage premiums for retirees will remain the same. For the Medicare standard plan options, the lowest plan option is $0. That's with United Healthcare, and the lowest premium plan option is $148.22. That's also with United Healthcare. Next slide. As I indicated, as you can see, the Medicare member rates for the standard and the premium plans. UHC Medicare Advantage standard plan, the $0 premium for their Medicare Advantage premium plan for UHC, it's $148.22. For Anthem's standard plan, it's $146.15. And then for their premium plan, it's $298.68. Next slide. The open enrollment is slated to begin on October the 18th through November 5th, 2021. We are planning to offer our retirees about 9 WebEx sessions and 10 teleconference sessions. One of the things we're going to do differently this year is for the actives, we will be offering 13 WebEx teleconferences. And so that will conclude the initial presentation. There are a couple of resolutions that we will obviously present to the board, but I will pause to see if there are any questions for any members of the board, Chairman Board.
Any questions, comments from the board, please? Louis, I have a question on the communication of the program for open enrollment and so on, is this, I heard your primary vehicle of communicating is going to be through WebEx, which is good. Does this environment of working from home and not in offices anymore, has it presented you any particular communication challenges that you've had to change in any way, the way that you communicate and get your open enrollment information out to people?
Well, as you know, Chairman Boyd, last year was the first year that the state, and like most employees, had to, really refrain from having the in-person meeting. The WebEx and the teleconference open enrollment meetings for the retirees were provided. We didn't provide anything for the active employees. Now, the retirees, as a matter of fact, will continue to receive the information as it relates to being mailed. So they'll have that. The information will also be on the SHBP's website. We're working diligently with our third-party partners, with school boards and everyone, to try to make sure that everybody get the information. The additional, as I indicated, for the active employees, we will provide the webinars for them. So we'll give them an opportunity to have interactions. And we're working with the third-party administrators to enhance. They will have kind of some live chat sessions. They will have opportunity to do question and answer sessions. And obviously those websites will remain open for the, throughout the year. But we seem to think that things have gone fairly well last year, and we're looking to enhance it. So, given the circumstances that we're in, not able to have the traditional in-person meeting, we feel as if, the WebEx and the teleconference and then the third party's involvement will address those concerns, any concerns we may have in terms of communications.
Thank you, Louis. Any other questions, comments from the board, please? And you're asking for the board, as I understand, you're asking for us to vote and approve as presented the rates and structure of the program, which is, I believe, is the board's responsibility to vote on those two items. Is that correct?
Yes, sir. So the next, there's three other additional slides that we will be presenting. There's a resolution that the board will need to approve from the employers. And then there's a resolution from the personnel, school personnel, and then there's a resolution for the members, and then the rates are actually presented as they are, Commissioner Boyd. And these are the rates. As we said, recommendation is to remain flat for the 2022 plan year, and the rates are provided before you now, sir.
Thank you. Is there I hear a motion for approval for the presentation on rates and structure?
Crutchfield will move, do pass.
Mr. Crutchfield has made the motion for approval. Is there a second?
Folsom, second.
Mr. Folsom has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Louis, and thank you very much for your presentation.
Thank you, sir.
That concludes the items for review and approval. In closing, I would simply remind you that our next meeting, August is a month, and we have two meetings. We have August 26th, and the primary subject, I believe, in that meeting, as in the past, will be budget that will be presented at that time. So we will reconvene at that time. In closing, I would just like to say, in view of what has unfortunately come about here is the increase in cases in COVID. I think that we have to extend, I'm sure I can speak for all the board members, and extend thanks to all the people that in this department and throughout the state that are working as responders to this a terrible disease again. Their contributions have truly been heroic and continue to be, and we need those people in our thoughts and prayers. And I guess from a personal standpoint, I would just say, get the vaccine. Thank you very much. And with that, unless there's
Mr. Chairman?
any other new business to come
It's
before
not-
the board.
Yes, Mr. Chairman, this is Mark Trail. I'd like to ask the department to, over whatever period of time is necessary, take a look at a recent article that was in the news about the referrals to be made from EPSDT reviews. We were identified as a state way behind on that, and I'm wondering if maybe a look at, do we have a reporting problem? Do we have a real quality problem? You know, whatever the issue might be, if the board could take a look at that and get some information back to us, that would be very helpful. Thank you.
Chairman, if
Would
I
you
might, sure, happy to respond. Thank you, Mr. Trail. The department is actively looking into that. We've got some teams that are reviewing that information as well as looking at claims information and to figure out if this is a real issue that we're seeing in referrals, or if this, as you indicated, is potentially a reporting issue. So as we dig into that, perhaps do some internal auditing of that data, we'll certainly report back to you and let you know what we find.
Thank you, Commissioner. Anyone else have any new business that needs to come before the board at this time, or any comments? Hearing none, the board meeting is adjourned, and thank you very much for your participation.
Thank you.
Bye.